Delivering a baby is good news for every mother, but it can also be high risk of any health problems. Women who come from underdeveloped communities are faced with a challenge at the time of delivery. Transport is a major problem as one has to walk long distances to access health facilities. Delivering at home could even be more dangerous should there be complications.
So the baby stays between the bones of the mother for quite a long period of time. And when intervention is not carried out, like to relieve the obstruction, then we end up getting a fistula.
Soft tissues of the pelvic are compressed between the baby's head and the mother's birth canal, and this denies them blood supply and die. In the end, a hole of fistula forms through which urine or feces or both pass uncontrollably. Fistula patients undergo psychological trauma as the situation subjects them to utter humiliation.
First of all, it's socially not acceptable to be leaking urine. So these women tend to be isolated. Even if they were working, they drop out of their job.
In Namibia, most patients come from rural communities due to low level of education, who too do not attend antenatal care due to long distances away from health facilities.
We get most of the patients in the Department of Urology, which is the only well-established department is in Windhoek. So every patient basically with a fistula has to travel to Windhoek. You can imagine the cost involved for all those patients to be traveling from villages to Windhoek. So yeah, it is a serious problem, and something needs to be done.
Obstetric fistula mostly affects first-time mothers, especially young women and girls, because of the narrowness of their pelvic.
One of the things that we actually advocate is to have these children stay in school for quite a long time. Mm-hmm. So first of all, complete their education before they think about becoming pregnant, leave alone getting into relationships.
Rehabilitation of fistula can be treated through vaginal surgery, but when it's too big to correct, one has to leave with a catheter. For the management and recovery, a patient should abstain from sex for at least 6 months.
But we advise people to delay conception for some time. At least for a period of maybe 2 years, so that they are really, they come back to normal.
The United Nations Population Fund is working towards developing a program that will entail reintegration and rehabilitation and provide patients with coping mechanisms. More education and construction of maternity waiting homes too is needed to prevent fistula cases. Fistula is a condition regarded as a silent shame. Silent because those affected are often too ashamed to talk about a problem that a few understand can be solved through medical intervention. I'm women-NBC News, Windhoek.